Do you have any suggestions on how to prepare up for the written exam and how to schedule your written exam, like how to schedule the studying?
I did use a lot of different membership level revision resources, either from the textbook or from the internet, like the question bank that you could find from the internet as well. They do ask a lot of membership level questions, although they may come out of some questions in the student level, but they're only occupying a small portions. So you're expecting your knowledge level should be achieving between the graduate and membership level. So aim high for your revision that you can make yourself well prepared for the exam. And well, just a little bit of my experience by the time when I was working and preparing for the exam, do use your time seeing patients to practice your clinical skills or your knowledges. By the time we're working as an intern or doctor, you will see a great variety of different real patients. Treat them as your exam tasks that you manage to complete your exam in 6 minutes for the exam. That could make yourself familiar with all the skills that you required for the exam. Sometimes you can challenge yourself or challenged by your colleagues on what you have done good or not good to brush up your skills or the way you perform. At the end, you get yourself pretty tight time, and then in the exam, you feel, okay, it's not too bad, but do make all your revision pretty tight and harsh to yourself to make yourself at the level beyond the required. At the end of the day, in your real exam, when you see real patients, difficult tasks, then you're able to manage in a good way, then you could get a pass. So don't be nice to yourself on your revision, be harsh. What about you, Marcus?
Yeah, so I think the strategy is very different. For the written, it's very much a solo endeavor. So I noted that a lot of you are really all over the world. We had some people dialing in today from Europe, for example, and obviously many from Australia. You're fine. You don't have to be in Hong Kong for that. I think that really you can just study on your own for the written part. It's very different for the clinical, but for the written, that's how I did it. I studied on my own. And one of the things, there's some like commercial available services to do like multiple choice questions, and those can be helpful to get a practice on doing multiple choice questions. Obviously, there's local resources as well, which the medical students in Hong Kong have put together. And so I think there's a number of ways to do it, but it's really focused on solo. And I mentioned earlier about not feeling ready. I totally did not feel ready. My wife was telling me, well, at first I said, like, I don't want to take it. I told her this, and it was like 3 weeks before the exam. And she said, no, you really should just take it and find out what it's about. That way you'll get better at it. She was very supportive. Luckily, I passed on the first try on the exam. And I think that really staying calm in the exam, because it can be very stressful, and approaching it in kind of I do eye surgery, for example. So, sometimes I say you channel your inner surgeon, you know what I mean? You're not freaking out in the operating room, you stay calm. And if you channel that sort of inner calmness to the exam, I think it can really help out, because you're really trying. I had passed my medical school. I had finished 15 years prior to when I did the written. So I feel like in some ways I'm the poster person for like, if somebody could do it, an ophthalmologist 15 years after graduation, I think anybody can really do it. I'm really optimistic about all you guys out there. I think you can do it for sure. So stay on it, stay on track. Keeping focused is all very important.
Well, so for the written exam, you can get epidemiology questions that you would never be able to answer. And that's, I think, I don't know, we've said this before, but the written exam is negative marking. So you get a quarter of the marks deducted if you get it wrong as well. So, for the writtens, if you don't know the epidemiology of the rate of, I don't know, smoking in Hong Kong, then just don't answer it, or make an educated guess.
Would you recommend subscribing to any med student levels or MRCP or MRCS or MRCHPCH or MRCOG level content if they use online resources?
I think that would be better to make yourself in the membership level questions. Well, I think the philosophy for my exam preparation, I always try to make myself at the level a little bit beyond what I'm required for the exam. Apparently, the HKMLE exam is a little bit required doctors who are experienced, not just a simply final year graduate doctor. So they are looking for people who are experienced in different areas. They are knowledgeable and they experienced on the way they present in clinical exam and in the MCQ. They know quite a lot of different special disease or difficult cases they are able to manage. Well, I think compared to the Australian exam, while we're trained to prepare all-round doctors in Australia, but in the Hong Kong system, we're aiming for quite advanced in knowledge, advanced in technology, or everything quite advanced. So you may even see the local graduates are asked to learn something close to the membership level. So when we are sitting for the Hong Kong LME exam, probably you should aim for a higher level, like to the membership level, to make sure yourself are able to manage most of the difficult questions and tasks in MCQ or the clinical exams. So I also did quite a lot of the membership level questions before I wrote into the MCQ exam as well, regarding the basic science, surgery, medicine, pediatrics, ophthalmology. Although for ophthalmology, it's quite a protocol driven. You may also reference with the local guidelines if possible, but do make yourself your knowledge level at the membership level. That would really help a lot.
Okay, what about Marcus? What's your take on this? I know you're also from the US.
Yeah.
Would USMLE resources be beneficial to this as well?
Yeah, it's interesting you ask that. It's totally like an FAQ. We get asked that all the time. I would definitely say it's a no on the USMLE, and you know, and I'm American, so I think I can just say that very neutrally. That while obviously it's near and dear to any U.S. Medical students' heart, with specific regards to Hong Kong, I would shelve the USMLE resources. I did use, just to get specific, I used the MRCP ones. So I got very acquainted with the UK resources. And I know that a lot of listeners are on this webinar from Australia. Maybe you have similar databases as the MRCP, but those are very helpful in terms of getting you primed to do multiple choice questions. I also did like 2000 MRCS questions, and I really did not find those helpful at all. So I'd recommend against MRCS resources. I think that there's other better ways to study for it. There's a popular local resource from CUHK that I think is a lot more helpful for example, the ONG topics, rather than doing questions for that. But for medicine, I would do MRCP as a help, as an adjunct. Yeah.
Okay, so it definitely depends on the subject that you're trying to revise for.